food, inactivity, leading to unhealthy lifestyle, obesity, these all become risk factors for developing cancers.
Hello everyone, Shrisha here, and I'm at Sterling for the Manipal Hospital's cancer awareness, mainly breast cancer awareness, and I'm here with Dr. Poonam, and we've had a great session where we were able to interact with patients and other doctors and even the caretakers as such. And being a food influencer, I'm here with some few questions that I would like to ask Dr. Poonam. Hello, doctor.
Hello, Srisha.
Yes. Being a young food influencer, I'm 24 years old, and I would like to understand, does food habits also affect a person's lifestyle, especially in women? Do you think food would also be a primary cause cause effects like this? And could there be precautions that can be taken with the food habits as well?
So, food has a very complex role in our lifestyle today. Earlier, we used to have only homegrown vegetables, home cooked food, and water from the well, and that was what our grandparents' life was, and even to some extent our parents' lives as well. But today, the lifestyle that we lead is a totally different lifestyle. The food, yes, we have so many malls and shopping centers which give vegetables. We really do not know. There is nothing like a seasonal vegetable now. All vegetables are available for 12 months of the year. Earlier we had seasonal vegetables and they had a different taste and a different pleasure of having different vegetables in different seasons. But today that is not there. We have everything every time. How it influences our lifestyle? Most of us are working professionals and we are always in hurry. The least time we give to is to food preparation, actually speaking. So we are all very fast, and we may cut corners. So I might get pre-cut vegetables from the market and cook it. I do not know what has been the quality of the vegetable that I have brought. I have just brought the pre-cut vegetables so that I just toss it in the wok and cook it and take it to work. To make things cook fast, maybe I'll just boil or I will put more oil so that it cooks early. Also, the type of food that we are getting, what kind of pesticides have been put, again I have no idea. So we are often clueless about the food that we are sourcing from the market, what kind of food that we are getting. Second, inactivity is also part of our life. We are most of the times working with the gadgets, sitting in a place, less physical activity, not getting up to even getting up for a cup of tea. Everything is there within our reach on the table. If I want tea, I just open the flask, empty it in the cup, drink. So physical inactivity also has become a part of our lifestyle. So these two things together, the food, inactivity, leading to unhealthy lifestyle, obesity, these all become risk factors for developing cancers. It's not in particular breast cancers, even uterine cancers, colorectal cancers have the same risk factors.
Point, doctor, like nowadays in this particular lifestyle especially, we are more prone to packaged food, and now like you said, we get everything pre-cut and nothing is being like given fresh to us, even though they call it fresh to home, come directly from the farm. We don't know what type of pesticides is being added. And do you think this would be a risk factor that's caused, and definitely would be a prime cause for cancer as well?
Can't say that, because cancer was there even when these things were not there. So, but yes, as I told you, that it's a complex interplay of lack of physical activity and the food choices that we make.
Okay. What is the primary advice that you would like to give to young girls that we in this session they also mentioned that cancer cannot be just above 40, but even women below that age, even in the age of 15 or 18, may try to get such symptoms. So what do you think, what kind of like what kind of remedies can be given for young girls in this part, and what can we do to prevent such circumstances?
So, young girls should learn to cook their own meals. So, not rely on fast food. Even if it is simple dal and rice, is all right. I think it is way better than having fast food, which is much more unhealthy.
Okay.
And eating a well balanced diet will never ever go wrong. There are so many diet fads that keep coming up time and again, but nothing has been proven superior to the other. And a balanced diet that we have been learning from class 1 will never ever go wrong. So, even if it is eating some sweet food, it should be in balanced quantities. It will never be wrong.
So you're saying that a diet would help everybody know how much they should eat, and portion control is one of the biggest things that this generation kids and women have to understand.
Exactly.
Okay, doctor. I have a think once a person or a woman is diagnosed with cancer, their food habits also might come to a control, or is it because they have to be in diet, or is it because they are diagnosed with the disease?
Diagnosis with a disease should not be the reason to go on to a special diet. If they are diagnosed with the disease and undergoing treatment, definitely they should have a good diet which is rich in proteins, vitamins, because for body's repair of wear and tear of tissues, we do require all the nutrients. Not one nutrient is essential. Everything is important for the body. So having again a well balanced diet is what is required. And yes, eating good fresh food, and so which are rich with their nutrients. If I keep something stale for a long time, if I have green leafy vegetables, eating them raw is better than eating them boiled and cooked. But yes, if they are on chemotherapy, we suggest that they should have all cooked food and nothing raw.
Thank you so much, doctor. I think this session helped us understand how much food also can help us impact in our lives, especially when it's a cancer survivor patient. Thank you so much, doctor.
Thank you.